Unlike false electropuncture diagnostics method, in which the energy potentials of organs and systems are measured through biologically active points, which describes the body's condition indirectly and often with a considerable error, the NLS method of analysis, developed at the Institute of Practical Psychophysics, makes an evaluation of organ's condition directly due to the resonance amplification of radiation signal of the organ under investigation, using a non-invasive trigger sensor. Every organ and every cell has its own distinctive oscillations, which are stored in the computer memory and can be displayed on a screen as a graph, which represents the conditions of the informational exchange between the organ or tissue and the environment. Every pathological process also has its own distinctive graph. Lots of pathological processes are stored in the program with the patient's age, sex, and selects the most efficient remedy. In the light of what has just been said, any disease can be represented as a disturbance of the harmonic synchronization in any biological object. The disturbance may be brought about by different causes that in turn can be regarded as disharmonic electromagnetic oscillations, causing blocks or noise, which interferes with the normal functioning of the body. It is now possible to eliminate these disharmonic oscillations by applying the laws of physics. In this case, the simplest way would be to use electromagnetic oscillations with the opposite sign, in order that the algebraic sum of disharmonic and inverted electromagnetic oscillations would become equal to zero. Guided by these conclusions, in the mid-70s, Dr. Morrell, together with another electronic engineer, E. Roche, invented a method and a device called MARA. The method of information therapy, or metatherapy, is a further advancement of the MORA method of solving the problem of restoring the body's normal functioning in the case of acute or chronic diseases. Metatherapy is a means of influencing the body through a combination of differently modulated electromagnetic oscillations emitted from the Metatron system. The scientists at the institute then became interested in the experiments of Professor Smith of Manchester University, who had proved that the water could remember the coherent frequencies of the radiation it was exposed in a variable magnetic field, and then retain its structure and the information about those frequencies for a certain period of time. It means that an effective correction of the disturbed balance within the body can be managed by means of information recorded on a matrix. Information preparations, or metazodes, are specific combinations of coherent frequencies chosen by the computer and are used to provide a ready-made dosage forms with a direct effect. They are produced by means of the apparatus, then transfers the frequencies information taken from pathogenidis into a matrix. It could be water, alcohol, or lactose. The metazodes have the effect of awakening of body's own hidden reserves, which accounts for the wide area of influence of the preparations and the absence of harmful side effects when prescribed with conventional remedies. The cost of NLS diagnostic systems is much lower than the cost of other methods of hardware diagnostics. Comparing with other methods of hardware diagnostics, NLS allows getting picture closest to pathologizing one. This, together with safety, promotes quick development of NLS diagnostics method.